For centuries, men and their families have grappled with a deeply personal question: to keep the foreskin, or to remove it. This question, steeped in cultural, religious, and medical significance, has sparked debates that have persisted across generations. In today's world, where scientific information is more accessible than ever, the conversation has shifted from one rooted solely in tradition to one increasingly grounded in health, function, and personal choice. There is no universal right or wrong answer to this question, no definitive directive that applies to every individual. Instead, the decision hinges on a complex interplay of evidence-based facts, individual circumstances, and personal values. This exploration aims to cut through the noise, providing a clear, balanced, and comprehensive look at the natural functions of the foreskin, the proven medical benefits of its removal, the potential risks involved, and the specific situations where circumcision becomes not just an option but a medical necessity. By delving into these aspects with clarity and precision, the goal is to equip readers with the knowledge needed to make informed decisions tailored to their own lives or those of their loved ones. To begin, it's essential to understand what the foreskin is and the role it plays in the human body. The foreskin, known medically as a prepuce, is a retractable sleeve of skin that naturally covers the head of the penis, referred to as the glans. At birth, the foreskin is typically fused to the glans, adhering to it much like a fingernail adheres to the skin beneath it. Over time, usually by adolescence, the foreskin becomes fully retractable, allowing it to slide back and expose the glans. Far from being a mere flap of skin, the foreskin serves several important biological functions that have evolved over millennia to support male physiology. One of the primary functions of the foreskin is protection. The glans is an exceptionally sensitive part of the body, with a high concentration of nerve endings that make it particularly responsive to touch and stimulation. Without the foreskin, the glans would be constantly exposed to external elements, such as the friction of clothing, environmental irritants, or bacteria. The foreskin acts as a natural sheath, shielding this delicate tissue from abrasions, dryness, and potential infections. It's akin to a built-in protective barrier, preserving the glans in a state that minimizes irritation and maintains its sensitivity. Beyond protection, the foreskin contributes to moisture and lubrication. The inner surface of the foreskin is a mucous membrane, similar to the tissue found inside the mouth or eyelids. This inner lining helps maintain a moist and chemically balanced environment around the glans, preventing it from becoming overly dry or irritated during sexual activity. This natural lubrication can enhance comfort and reduce friction, facilitating smoother and more pleasurable experiences for both partners. The foreskin's ability to glide over the glans also plays a role in this process, creating a natural mechanism that supports sexual function without the need for external lubricants. In many cases, perhaps one of the most significant aspects of the foreskin is its role in sensation. The foreskin is rich in specialized nerve endings, including fine touch receptors that are highly responsive to subtle stimuli. These nerve endings contribute to the sensory experience of the penis, playing an integral role in sexual pleasure and arousal for many men. The presence of thousands of these receptors means that the foreskin is not just a passive piece of tissue but an active contributor to the sensory feedback that enhances intimacy. This sensory role has been a focal point in discussions about circumcision, as the removal of the foreskin inevitably alters the sensory landscape of the penis. For thousands of years, circumcision, the surgical removal of the foreskin, has been practiced across cultures and religions, often imbued with symbolic or spiritual significance. In ancient times, it was performed as a rite of passage, a religious covenant, or a cultural tradition. In modern times, however, the decision to circumcise is increasingly approached from a medical and health-oriented perspective. Parents of newborns, adult men considering the procedure, and healthcare providers alike weigh the potential benefits against the risks, informed by a growing body of scientific research. So, what are the documented medical advantages of circumcision, and how do they stack up in today's evidence-based world? One of the most frequently cited benefits of circumcision is improved hygiene. A circumcised penis, with its glans permanently exposed, is generally easier to clean than an uncircumcised one. The foreskin, when present, can create a warm, moist environment where smegma, thick, whitish substance composed of shed skin cells and oily secretions, can accumulate. While smegma itself is harmless and can be easily washed away with regular hygiene, poor cleaning habits can lead to its buildup. This can result in unpleasant odors and create a breeding ground for bacteria, potentially leading to inflammation or infections. By removing the foreskin, circumcision eliminates the space where smegma collects, simplifying the hygiene process and reducing the risk of related complications. This brings us to another significant advantage: a reduced risk of certain infections. The area beneath the foreskin can trap moisture and bacteria, increasing the likelihood of conditions such as balanipostitis, an inflammation that affects both the glands and the foreskin. This condition can cause discomfort, swelling, and redness, and in some cases, it may require medical intervention. In infants, circumcision has been shown to significantly lower the risk of urinary tract infections (UTIs), particularly in the first year of life. Studies have demonstrated that uncircumcised male infants are at a higher risk of UTIs due to the potential for bacteria to thrive in the warm, moist environment under the foreskin. By removing this tissue, circumcision reduces the likelihood of such infections, offering a protective effect that can be particularly important in early childhood. Perhaps the most compelling evidence in favor of circumcision comes from its impact on sexually transmitted infections. Over the past few decades, large-scale, randomized controlled trials considered the gold standard in medical research have provided robust data on this topic. Landmark studies, including those published in prestigious journals like The Lancet were conducted in regions of Africa with high STI prevalence, particularly HIV. The results were striking. Male circumcision was found to reduce the risk of acquiring HIV through heterosexual intercourse by up to 60%. This protective effect is attributed to the nature of the inner foreskin, which is thin, non-keratinized, and rich in immune cells that HIV and other viruses target for entry into the body. By removing this vulnerable tissue, circumcision eliminates a primary gateway for infection. The benefits extend beyond HIV. These studies also demonstrated a significant reduction in the transmission of human papillomavirus (HPV), a virus linked to genital warts and several types of cancer, including cervical cancer in women and penile and throat cancer in men. Additionally, circumcision was associated with a decreased risk of acquiring herpes simplex virus type 2 (HSV2), the virus responsible for genital herpes. The mechanism behind these reductions lies in the removal of the foreskin's inner lining, which is particularly susceptible to viral entry. However, it's critical to emphasize that circumcision is not a cure-all or a substitute for safe sex practices. While it reduces the risk of certain STIs, it does not eliminate it entirely. Condoms and other preventive measures remain the most effective tools for STI prevention. Another medical advantage of circumcision is its association with a reduced risk of penile cancer. Although penile cancer is exceedingly rare in developed countries, its risk factors include chronic inflammation, poor hygiene, and HPV infection, all of which are mitigated to some extent by circumcision. By improving hygiene and lowering HPV transmission rates, circumcision is directly linked to a lower lifetime risk of this rare but serious condition. This protective effect, while not a primary reason for most circumcision decisions, adds to the list of potential health benefits. However, no medical procedure is without its drawbacks, and circumcision is no exception. As a surgical intervention, it carries inherent risks. Even when performed by a skilled professional in a sterile environment, the most immediate risks include pain, both during and after the procedure, particularly in the initial healing period. While pain management techniques, such as local anesthesia, are commonly used, some discomfort is inevitable. There is also a small risk of bleeding or infection at the incision site, though these complications are rare when proper protocols are followed. In some cases, cosmetic issues may arise, such as scarring, asymmetry, or the removal of too much or too little skin, which could necessitate corrective surgery later. One of the most frequently debated disadvantages of circumcision is its potential impact on sensation. As previously noted, the foreskin is packed with thousands of fine-touch nerve endings that contribute to sexual pleasure. Removing this tissue inevitably alters the sensory experience of the penis. The glands, now permanently exposed, undergoes a process called keratinization, where the skin becomes slightly thicker and less sensitive over time, as it adapts to constant contact with clothing and other surfaces. For some men, this change is negligible, and they report no negative impact on their sexual satisfaction. Others, however, describe a reduction in sensitivity that they perceive as detracting from their sexual experience. The subjective nature of this issue makes it difficult to quantify, but it remains a valid consideration for anyone contemplating circumcision. Additionally, the removal of the foreskin means the loss of its natural protective and lubricating functions. Without the foreskin, the glans is exposed to constant friction, which can lead to dryness and irritation in some cases. The absence of the foreskin's mucous membrane also means that the natural lubrication it provides is no longer present, which may affect comfort during sexual activity for some individuals. While these changes are not universally problematic, they represent a permanent alteration to the body's anatomy and function, which must be weighed carefully in the decision-making process. Beyond the foreskin itself, many men grapple with broader concerns about sexual health and performance, particularly the ability to achieve and maintain strong, confident erections. These concerns often extend beyond anatomical considerations and touch on deeper physiological and psychological factors. Recent advancements in biomedical research have shed light on natural, non-invasive approaches to addressing these issues. For instance, a leading biomedical engineer has developed a simple, 7-second home remedy that targets the root causes of male performance challenges. Without relying on medications or invasive procedures, this remedy, grounded in scientific principles, offers a promising option for those seeking to enhance their sexual health naturally. For those interested, resources such as instructional videos or guides are often available online, providing accessible and practical information for men looking to address these concerns. Returning to the central question, there are specific medical situations where circumcision transitions from a choice to a necessity. One of the most common conditions is phimosis, where the foreskin is too tight to be retracted over the glands. In mild cases, phimosis may be manageable with improved hygiene or topical treatments, but in severe cases it can prevent proper cleaning, lead to recurrent infections, and cause significant pain during erections or intercourse. When conservative treatments fail, circumcision is often the definitive solution, restoring comfort and function. A more urgent condition is paraphimosis, a medical emergency in which a retracted foreskin becomes stuck behind the glands and cannot be returned to its normal position. This creates a tourniquet-like effect, restricting blood flow to the glands and potentially causing severe tissue damage. Paraphimosis requires immediate medical attention, and circumcision is often recommended to prevent recurrence. Similarly, men who experience chronic, recurrent infections such as balanoposthitis, despite adequate hygiene or medical treatment, may find circumcision to be a curative option, eliminating the underlying anatomical factors that contribute to these infections. For individuals without these medical conditions, the decision to pursue circumcision is highly personal. For parents considering circumcision for a newborn, the choice is often influenced by cultural, religious, or preventive health considerations. In regions where circumcision is common, such as the United States, some parents opt for the procedure to reduce future health risks or align with social norms. In other parts of the world where circumcision is less prevalent, the decision may lean toward preserving the foreskin unless a medical issue arises. For adult men, the decision often hinges on personal preferences, weighing the potential health benefits against the risks and the desired cosmetic or functional outcome. Ultimately, the choice to circumcise or not is not a one-size-fits-all proposition. The foreskin serves valuable biological functions, from protection and lubrication to sensory enhancement, but its removal offers significant, scientifically supported health benefits, particularly in reducing the risk of infections and certain cancers. At the same time, circumcision is a surgical procedure that carries risks and results in permanent changes to the body, including the potential for altered sensation and the loss of natural protective mechanisms. The decision requires careful consideration of both sides, informed by accurate, evidence-based information and tailored to individual circumstances. For those experiencing pain, discomfort, difficulty with foreskin retraction, or other related concerns, the most critical step is to consult a medical professional, preferably a urologist. A urologist can perform a thorough physical examination, assess the individual's specific anatomy, and provide a personalized recommendation based on their health and needs. This is not a decision to be made lightly or based solely on online forums, anecdotal stories, or cultural pressures. A qualified healthcare provider can offer clarity and guidance, ensuring that the choice aligns with the individual's best interests. In navigating this complex and often emotionally charged topic, the goal is not to advocate for one choice over another, but to empower individuals with the knowledge needed to make informed decisions. Whether driven by medical necessity, preventive health considerations, or personal preference, the decision about circumcision is deeply personal and should be approached with a clear understanding of the facts by weighing the benefits, risks, and individual circumstances. Men and their families can arrive at a choice that feels right for them, grounded in both science and personal values.